Hey, good evening, everybody. It's Scott here. I'm going to give a few minutes and wait to see if anyone checks in. And before I start talking here, it's going to be a short one, I think, unless I get a lot of questions. But um, for the most part, I think it's going to be rather short. So I was running a little bit late. I was taking my usual nap, which is what I've been doing a lot this past 3 weeks. Hey, Amy. So if all of you are just starting to check in here and want you to know what this video is about, just to give you a brief, I've been journaling my amputation of my leg. Good morgen in the Netherlands. Been journaling and doing entries on my leg amputation for my patients, my clients, my friends, family, etc. So we're at 3 weeks now after the surgery, and I go in this coming, Tuesday, to see if I can have all my stitches taken out. So everything's going great. I spoke with the prosthetic. I'm not quite sure how you call them, prosthesis. And they said that I'm actually ahead of the game, that I'm doing more than usual. So that's rather cool. They said they're usually not doing everything this early in the game, but I've been trying my darndest to do so. So when I can't sleep at night, I'm doing things like that you usually wouldn't do, baking or cleaning stuff or what have you, just to stay active. Doing a lot of exercises, my leg. Been finding this whole time, I've been finding various different ways of doing things that I'm not used to. So I had a friend on here not too long ago say that, don't worry, Scott, what you're not used to will become your new norm. And she was very right, because I'm finding ways to stand on my existing leg, to do things like in the restroom and in the kitchen and what have you, and learning to stand by leaning against one side of my hip or the other, to be able to keep balanced, because it's amazing how much your body loses balance, even with below the knee amputation. I couldn't even imagine what my friends or folks out there have to go through when they have more removed. But just with that little bit, you lose a lot of balance. Your body does adjust to the weight of your leg. I've lost 20 pounds since the amputation, and not all that 20 pounds is my leg being gone. But with that said, what I used to be able to have more balance, I thought I had balance on my left leg, actually changes very drastically once it's gone. So you have to find new ways to keep your balance, new ways to move. Like when you're even washing your hands at the sink, it's very difficult. So you just have to change your ways, I guess. So my advice to anybody out there that's having to have anything like this done, this amputation, I would suggest, again, your weeks prior to the surgery, you want to just research, and I can't stress that enough about what you're heading into. And then, of course, you have the surgery, and then afterwards, your 3 weeks afterwards is nothing but I was pushing myself like I normally do, but it's nothing but recuperating your body and getting your body ready for the next step. So as of next Tuesday, I will begin the next step process. They'll see if they can take out the sutures, and then they put what they call a shrinker at the bottom of the foot, or the bottom of the leg. Right now, what's happening is not only is the sutures trying to dry up and heal. I have one little part that's still wanting to peek open, but not to the extreme that I think they're going to wait, taking them out. But right now, the muscles will what they call atrophy. They will atrophy, or they will begin dying away because you're not using them. So during the next 3 weeks, they're going to put a shrinker on that leg or the bottom of the stump, and they will shrink that until it gets close to that swelling's gone, all the excess tissue's gone. They have the real stump to work with, so they can start fitting me then for prosthetic. So I have 3 weeks of shrinkage, if that sounds right. Really doesn't sound right, but I have 3 weeks of the leg to shrink down, and then they'll fit me for my prosthetic. And we're setting that goal for before Thanksgiving to be able to be on back up and walking again. So we'll see what happens. My body seems to take a lot of hits, and when it does, I'm down for a couple days, and I try to sleep it through. I haven't been on pain meds for quite a while. I think after the second week, I quit taking Tylenol. So there's a lot of itching going on, and I think that's a good thing for the most part. And the only other thing is the anxiety and depression. The doctor warned me of that. And I thought, no, I'm not going to have any anxiety or depression, but it just so happens that you do. So I think right now, more so than depression, it's anxiety. So every little thing shoots me off. I did get out my first time, thanks to a friend, Julie, and was out for just a little bit. I would say maybe we were out for an hour and a half. And it kind of wore me out. Towards the end there, and it's only something within me. I had a problem with people walking in the grocery store or whatever and having people look at me. You really start to see how it feels, both emotionally and physically during this, especially when you have other people staring as much as they do. And we in society are so used to looking at that as a negative thing, like, oh, they're looking at me, they're thinking bad of me, when instead they're looking at you because they're thinking, oh, wow, you just went through a leg amputation. But in my eyes, I'm thinking, oh, man, I can't, how can they look? I can't stand this. So then my emotions get the best of me, and I get anxious, and then I just want to go home. And then I go to sleep. And I got to get my mind set for a different way. I will tell you, hi, Miss Linda. I will tell you something that is kind of wonderful in my field with massage, is because I had that one part in my leg, and I had a lot of bone pain in my leg. Sorry, Linda. She said she couldn't find me, and I think I was supposed to have a lot more people on here, and I think the problem is I did something wrong, but I'm here. So sorry about that. I'll know better next time. So I can't remember what I was saying now. Hi, Carol. She found me too. Great. Oh, goodness. I'm so sorry, guys. I forgot my train of thought here. Thanks, Linda. No, I'm just kidding with you. I lost my whole train of thought. I can't remember where I was. But yeah, anyhow, the bone pain. Okay. So I've been having a lot of bone pain. And when the bottom of the knee, you got your tibia and fibia. It's the two bones, of course. The bones are pretty much aching underneath the knee and tender to the touch sometimes. And around the sutures were getting tender. And so what I had done was I took all the wrapping off my stump, and I started giving myself a massage on my leg. And at first, of course, something like that always hurts. And then as you do it and the blood starts circulating and the muscles start relaxing, then you start being able to feel more of a relief, which is usually when you have any type of problem with your muscles. That tends to happen when I do massage. You know, it may hurt a person at first, but then it starts working itself out, relaxing, and whatever tissue is too hard or too tender starts becoming more relaxed. So I did that around the tissues, getting the blood circulating and moving. Underneath the sutures at the bottom of the stump, it was almost ticklish, like a stick on my feet. It was a weird sensation. I had to do that slowly and softly, and then I got deeper in the tissue as I went. And then 2 days after that, I noticed that the wound was actually closed. It was just scabbed over. So I had the blood circulating in there. So it's wonderful. I give post-op massage and was giving it in my clinic before this happened. And it was fascinating to me how when I massaged around the suture sites or the surgical sites, how much of a relief, after a half an hour came to the patient. And then to see the healing process actually take place was always a wonderful thing for me. Well, now I'm the patient and doing it to myself. I'm like, yeah, this is great. So we know it works for real. So other than that, again, keep your fingers crossed. Tuesday I'll find out whether the sutures come out. Our goal is to have them come out. And so I've been like letting my stump dry in the air a little bit, trying to get those sutures dried up so I can have them out. So I've been taking off the dressing a little bit at a time. But other than that, folks, it's just these past 3 weeks have just been healing and relaxing the body. And then I'll get these little energy spurts. I'll do something and I'll try to push it and then I'll go back to normal. So once I get my shrinker on the leg, then what I'm going to do is start my exercise program that I have lined up. So I'll start exercising not only the leg, but as I told you in the prior videos, the abdomen for the back and what have you. The hard thing, though, is trying to get you could do it in the bed, but me, I like to push a step further and do it on a harder surface. So I'm probably going to try to do it on the floor. And this will be another experience because I'm going to try to figure out how I'm going to get up off the floor with the one leg. So, but that's okay. And you might think, oh, what's he talking about? What's the big deal? No, it is a big deal when you're not used to it. Believe me. So I would like to have a way for people to actually understand what an amputee goes through. And I think I'm going to throw a challenge out there here in the next couple weeks. I've been thinking about it. And I'm trying to think what I want to raise funds for amputees. But the challenge I have is the challenge I have is going to be, I think, pretty cool if I decide to go forth with it. But I just want everyone to we don't experience what others go through, and I would really like for them to do this in a 24-hour period, just to see what you have to do to make a difference or a change. And even if the person has surgery, and a lot of people out there know that when you can't use a limb, how difficult it is to go about your daily business, dressing, bathing, eating, your activities of daily living goes, and then you have a learning curve to try to learn everything all over again in different ways. I just so happen to be a creative person all these years, and so it's like when this happened and I knew I had to do this and that and the other, and I wasn't able to do the way I used to do it, then you very quickly it shoots in my mind, okay, how can I do this differently? Now I know physical therapy and other places would say that I was, no, that's not safe because they love arguing with me in the hospital. But no, it might not be safe and it might not be the way we're supposed to do it, but this is how I can handle it. So, so that's coming. That's been happening in the past 3 weeks. Now we just wait till Tuesday and we go from there. So again, I thank everybody for their thoughts and prayers. And I want to send, hey, Jose, I want to send a special thank you out there to my friends that's been sending me cards and what have you, and put me in your prayers and emails and it's been wonderful. I can't express that enough. Um, I know I was telling a lot of people, I wasn't ready for visitors. Mentally, you just aren't, and you just don't feel, yourself. So bring it if you guys want to come and visit. I'm here. So just overlook everything because I haven't been able to get to everything like I should. You just can't. I'm still learning that too. But please, thank you again, and prayers out there to everybody that are needing them right now, whether it be um, something medically going on or any type of grievance they have or grieving that they have going on right now. I just want to say thank you, and your prayers are being sent to you. The reason I said thank you is because I was talking to somebody I'm a gamer to some extreme. I like to go on to the computer for virtual reality, and you meet people from all around the world, and it's really cool to talk to them. And so whenever something like this happens, when I can't walk, um, the armed services has been using a tool, and I've advertised it to you before, called Second Life, secondlife.com. It's a free tool, and you go in and you can choose your avatar, and anything you can do in real life you can do on there in virtual world. And so the Army and what have you has been using it so that they can, their amputees that they have, they've been using it to help them move and to feel better about themselves and their self-esteem. And in the past, when I had other issues going on, it helped me out tremendously, because back in 2010, when I was going through my master's program, I discovered that website, and for marketing purposes. And I have to say, back then I had the foot surgery, and I couldn't walk for 6 weeks or more. And I used that as a way to get away because of the pain and the way I was feeling that. And it was supposed to be used for business, but it was quite remarkable what it actually did for your psyche, and to help you from the depression and to make you feel like you can conquer anything. So now they developed it in the hospitals in the service so that they can actually use the virtual gear to help people walk and feel more alive and do things they've never been able to do before. I actually had someone working for me on the virtual world doing real life work. It was for charitable organizations, and she was doing all kinds of like spreadsheets for me, and we're finding all the organizations that were within that virtual world. And I gave her an assignment that morning, and I didn't expect it to be done for a few days. That actually came in 4 hours later, and she had over 80 organizations that have been using it, had all their demographics, their information, everything. I'm like, wow, you didn't have to do this. I mean, it's not really like a real job. I just gave it to you to come to find out this lady, which I would have hired for my business in a heartbeat. She was a quadriplegic, and all she could do was to be able to operate the computer with her mouth. And I had not known that, because of course you're presented with an avatar and you don't know what color they are, you don't know who they are, you don't know male, female, you have no idea. Most wonderful way to interview a person without prejudice. And I had her working, and she was wonderful, and here she was a quad, but this gave her a way to feel like herself, like she was worth something. And so mentally it did wonders for her. So make a long story short, I've been on there, and I happened to come across somebody who was a Christian, and I was telling him about my amputation, and all of a sudden, lo and behold, I start getting all these note cards being sent to me. And what the note cards is almost like instant messaging, sort of, after the fact. So, and on those note cards were just lines and lines of people that need prayer. And I was like, wow, what is this? And he went and left me a note and said, hey, buddy, your prayer warrior here Would you like to help me get some prayer sent out? And I about was floored because I started reading all these problems that people were having and the illnesses that they're having and the loss in their lives that they're losing and missing. And it just went on and on. It was almost like Santa Claus getting the delivery from the children. Um, and then you started feeling not so alone, but you started feeling like your problem is less than others. And so what I've been doing is on a weekly basis, I'll go in to see what he sent me and I'll start praying on it for people. So um, as you're praying for me, I'm praying for you and everybody else out there that needs it, because everybody does in one way or another. So bless you all for doing that. And Miss Linda, I just got the message from you. It is a big deal when you can't get on your knees, even with knee surgery. Um, yes, I can imagine that would even be the worst circumstance. I was watching a video the other day also where someone had a double amputation, and it was phenomenal. It was just phenomenal what they were doing without legs. And we're not talking about, we're talking about pretty healthy guy, walking around the house on his arms to try to get what he needs done, and how he hops from one thing to another. I don't know how I would do it. I'm having a problem with just, below the knee. Not a problem, but it is a problem. So I couldn't even imagine. I was expressing to someone the other day. I remember years ago when I worked in rehab, and when I was a young man, I walked in and didn't understand because the guy had thrown the other guy's wheelchair over and across the room. They were young, probably in their late 20s, and they had either quadriplegic and one was missing a leg. And I said, well, you don't want to do that. Don't do that. And he goes, you shut up, get over there. I'm like, whoa, what's wrong with this guy? Well, what was wrong was I now realize it was to build strength. That guy had to crawl over and get his wheelchair, flip it up without legs, and be able to get in it without anybody helping him. Because if you're by yourself, who else is going to help you but yourself? So you have to learn those things. You have to learn it the hard way. You only have so much time in it to learn. Now I'm getting it. And so someone will ask me if I need help. I'm like, no, because I want to do it on my own to be able to get to that next step. So I'm actually arguing a lot with family right now because I want to actually drive. You didn't hear that? No, it's all here now, but I want to actually get in the car and drive. I practiced a month before this happened to drive with my left foot. And now nobody's let me drive with my left foot. So we'll see what happens on Tuesday. Hey, Sue-Ann. Hey, Deb. So other than that, does anyone have any questions before I go? This actually turned out to be more people than I thought was coming in. So everyone, keep your fingers crossed, prayers said. And again, goal is on Tuesday, sutures out, and the shrinker for the leg comes on. And then 3 weeks later is when I get the prosthetic, hopefully. So I think I'm going to keep this more like a weekly thing to give updates, because every time I turn around, there's a new experience. For instance, did anyone get up in the middle of the night and kick off their blankets? I do. I have the blankets on. I kick them off. And I was just saying the other day that I was having problems because I thought it was in a dream or something, because I'm stuck in my blanket. My legs kept kicking off the blanket, and the damn blanket wouldn't come off, right? And I'm thinking, what the heck? The reason it wouldn't come off was because there was no leg there to kick anything off. So here's my stump like going underneath the blanket trying to kick the blanket off, and I'm all wrapped up in it. So there is some fun in it. I can laugh about it, and that's what we're supposed to do. So Peter says, get a self-driving Tesla. I call the wheelchair a Tesla. That's probably the only Tesla I'm ever going to have at this lifetime. And no, Miss Linda, I'm not serving cookies. However, I don't know what the winter's going to bring. I might as well mention it now. Love you too, Tara. That I'm trying to think of things to keep me occupied, because I am going nuts just sitting here and not doing anything. I can't do it. I can't. And if I could, I'd hang a sign out front this door and have people come in for massages where I can sit in a chair and do them. I'm going nuts, stir crazy. So yes, I've been baking. So far, I made orange spice cookies. I've made Cheryl's cookies, copycat recipe. I will be making pumpkin cookies, and I'm going to start on the Christmas cookies because I don't know if I'm going to. To be honest with you, I'm a good baker. I just have to say, sorry, ladies, but I am. And so I'm not quite sure if we're going to sell cookies for the holidays or not. I will completely consider bringing back my candles for this holiday because I've been called in with some orders, and I told them I couldn't do it. And people from the clinic's been wanting them because that's where I sell them at. And the holiday scents are just awesome. It smells like sitting in a log cabin home with all the leaves outside and the fireplace going, and all those lovely things. Nice little chill. And I have to say they're awesome scents. So I may bring them back. I'll announce it next time. I think I have an idea with that. Instead of having a storefront, I may do something else. But we'll talk about that later. I hope all of you. Hey, Stace and Bruce. I'm assuming. How you doing, bro? I just had someone sign in, you guys, that I haven't seen for over 30 years, and he's a brother I never had. I've always thought of him as a brother. It's from college, so he and his wife, it looks like, just signed in, and gosh, that means a lot, because we don't get to see each other that much that often. So thank you for signing in, especially through this point in time. Wow, this really that got me. And I'll tell you why. I'll tell you why I'm teared up right now. This guy is remarkable. If I ever had a brother, it's exactly the type of brother I'd ever want. And he could leap mountains when we were in college together. And I always looked up to him. And he never let me down. I just can't believe I've actually seen him sign in. So, wow, okay. So, you guys, later on at 10 o'clock, this experience has been something, I tell you. I hope you guys can join me just for some fun. I started a podcast to keep me busy and occupied while I'm going through this because, like I said, I'm stir crazy. I'm trying to just think of different ideas. I've even taken up some classes, finance classes, to add to my master's on this side because I can't stand just sitting still. So, I'm so sorry. You guys are wonderful. So I started up a podcast. So at 10 o'clock this evening, we're going to be live. I've sent everyone links to it. And what this is going to be about is just something fun for Halloween. I'm going to do it every Saturday, I believe. And we're going to talk about urban legends and scary, ghostly stories we've had as kids or as adults. And it's going to be rather fun. If you were a child like me where I grew up in the country, my mom was trying to scare us kids. And it was amazing what different things she would do to scare us during the Halloween months. And plus, there's a lot of superstition around us because we lived around the Amish and the Pennsylvania Dutch, so we were surrounded by superstition. And so it'd be interesting to see who joins me. If you need a link for that, you do have to do a short download for an app, and it's called Podbean, and they have their own app. But if you ask for my link, or if you see it on my feed, just go into there for the 10 o'clock live feed for Dreamtime Hour. and download that on your phone, and you'll be able to actually call in and tell me your story so everyone else can hear it. And you can also have a chat with me while we discuss the hauntings of Halloween, just for fun. So until next time, please keep me in your prayers. I'm going to keep working past this. And like I said, the goal is Thanksgiving. We're going to be walking. So let's hope that comes true. And if all fails, plan B is Christmas. But I definitely want to be up and walking by the beginning of the year. So so far, I'm trying to get used to everything. I'm manipulating my wheelchair so it benefits me better. Keeping my gloves on so my hands don't get blistered as much. And now I'm starting to use arm crutches a little bit at a time to build up the upper body strength. So we'll see what happens. All right. Thanks for hanging in there. I'm sorry this is so lengthy, and I'm sorry I'm kind of emotional today. It's happening lately. I don't know why, but I think it's a positive thing. So peace to all of you out there. I love you all, and thank you for standing by me and for all your support. Couldn't do it without you. I greatly appreciate it. So please come back next time. And hey, Trish, and we'll see you soon. Stay well. Bye for now.